Hi there. My name is Dr. Lochte, and I'm a psychiatrist currently practicing in Santa Monica, California. Today I'd like to talk with you a little about melatonin. Melatonin is a really commonly used health supplement that people take to help improve their sleep. What I noticed is that a lot of people that take melatonin are actually taking it in ways that aren't really recommended by the recent research. In fact, in places like the UK and Europe and Australia, Japan, and Canada, melatonin's a product that's regulated and is only available by prescription and with careful monitoring. What's important to realize is that melatonin, even though it's on the shelves next to a lot of other dietary supplements, it's actually a hormone released deep within the brain. Because of this, it can actually have wide-ranging effects on the body. Even though we mostly think of it for sleep, we're actually finding out that it can have influence over body temperature, blood sugar, and even things like sex hormones. The other thing that's important to know about melatonin is that we've started to change how we think about the dose of melatonin, and we think that more recent evidence shows that actually less than 1 milligram of melatonin might be the optimal dose. This is a little concerning because on shelves, most of the times you can only find it between 3 milligrams and 10 milligrams. And one study found that when you actually take a 10 milligram dose of melatonin, it raises your blood plasma levels 1,000 times more than the peak physiological concentration. On top of that, because melatonin isn't regulated by the FDA, it can actually have a lot of variability in how much melatonin you're getting in your product. In fact, one study found that 70% of melatonin products on the shelf only contained less than 10% of what they were advertised as, and some products even contained way more, up to 5 times as much melatonin as was listed on the product. That being said, melatonin is actually a very popular health supplement, and is actually the 4th most common health supplement in the US. People find that it's a mild and reliable way of getting better sleep, and this is largely supported by randomized clinical controlled trials, which show that it actually can help reduce sleep latency or time it takes to get to sleep. It can also reduce nighttime awakenings and prolong and expand the duration of actual sleep time. But I hope it's also clear that this is a little bit more of a complicated medication than you might have given it credit for. And I'd like to give you all the information that I've learned over the years about melatonin and hopefully help you make a more informed choice about whether or not you want to take this medication and how specifically you plan to take it. Melatonin is actually a natural hormone that's produced from the amino acid tryptophan and is secreted by the pineal gland in the brain. Its peak and fall serve as one of the main regulators of our circadian rhythm, along with other chemicals like cortisol and adenosine. When we observe daylight, a signal is sent to the part of the hypothalamus called the suprachiasmatic nucleus, which in turn regulates the release of melatonin from the pineal gland. Daylight, and specifically blue light, actually inhibits melatonin, while darkness allows for its release. Melatonin levels will begin to rise in the evening when the sun goes down, they peak in the middle of the night, and they'll fall again by the time that the sun is coming out in the morning. The most important takeaway from this video is that melatonin actually has 2 different uses. The first use is its hypnotic effect, meaning that it can cause sedation. The second use is that it has a chronobiotic effect, meaning that it can actually shift the circadian rhythm. First, let's talk about the hypnotic effect. If you take 5 to 10 milligrams of melatonin, about 60 minutes later, you'll start to notice feelings of sedation. You'll see a decreased level of alertness and a reduction in your core body temperature. Most early melatonin research looked at this type of hypnotic effect, and this is probably influenced why over-the-counter melatonin is sold at a 3 to 10 milligram range. This way of taking melatonin is helpful for some people, but it's starting to fall out of favor amongst psychiatrists. Let's now talk about the chronobiotic effect, or being able to shift that circadian rhythm. This effect is interesting because it actually doesn't cause any sedation. Instead, it indirectly improves sleep onset by shifting the phase of your natural circadian rhythm. If you take 0.3 to 3 milligrams of melatonin, this will actually kickstart the natural increase of melatonin that occurs every night. In a few hours, you'll naturally just want to go to bed without feeling overly sedated. This has actually started to become the way that many psychiatrists approach melatonin, and it's very effective at treating delayed sleep phase disorder, as well as sleep onset insomnia. After all, a lot of sleep onset insomnia actually has more to do with the natural night owls not being able to fall asleep at the time they need to wake up for work or to go to school. This way also allows us to adjust the sleep onset while maintaining the sleep structure. This means that unlike other sleep medications, REM sleep isn't affected, tolerance doesn't develop, and there's minimal hangover the next morning. However, you'll only see these effects when melatonin is used in this very specific way, with the low dose taken early in the evening. And this isn't the way that it's marketed on most product shelves. The other thing that's important to keep in mind is the formulation of the melatonin. Oral melatonin is rapidly absorbed with peak levels 20 or 30 minutes after oral ingestion. However, there's also a very short elimination half-life of 40 to 60 minutes. So when you take immediate release melatonin, the concentration spikes up and then drops off very quickly. Immediate release formulations can be helpful in getting people to fall asleep quickly and helping with sleep onset insomnia. And they're also pretty good at not causing that next day drowsiness. But I've noticed that a lot of patients will have a problem where they actually wake up in the middle of the night, maybe at 3 o'clock in the morning, when the blood levels of melatonin seem to be dropping out of their system. This isn't as much of a problem in extended release formulations, and these ones work by actually distributing little bits of melatonin throughout the night. These ones are better for sleep maintenance insomnia or sleeping throughout the whole night, but they can actually have another issue, which is causing some grogginess in the next morning. In general, melatonin is pretty well tolerated in the short term, meaning within 12 weeks. Most psychiatrists consider it to be a very safe medication, and we don't really have any clear evidence of it causing any long-term harm. However, it's a hormone which can have wide-ranging effects on the body that sometimes we don't always fully understand. Some of the side effects of melatonin, well, the most prominent one is just other sleep issues, things like daytime sleepiness, nightmares, and sometimes you get these midnight awakenings. All the other side effects usually occur at a rate of less than 1%, but these can include things like headache, dizziness, feeling cold, nausea, palpitations, and skin irritation. It's also important to be aware that there can be medication interactions with melatonin. For example, if you're taking something like Luvox or birth control pills, they can sometimes increase the levels of melatonin. You can also get melatonin can cause an increase in the level of drugs like Valium. Another thing to keep in mind is that melatonin is a hormone, and as a hormone it can interact with other hormones in the body. Melatonin levels rise when people go through puberty, but we don't really know the nature of this association. In rodents, melatonin is actually considered an anti-gonadal hormone, reducing gonadal size and fertility in rats. However, we haven't really seen any effect like this in humans, but at the same time, we don't really have enough information to say for sure that there isn't a sex hormone effect from melatonin. It's generally considered safe to use, but some people recommend a little caution when used in children going through puberty and in women of reproductive age. Melatonin can also increase blood sugar. What we found is that actually the pancreatic islet cells have melatonin receptors. When melatonin binds to these receptors, it can actually stop the secretion of insulin, causing a rise in blood sugar throughout the night. At high doses, melatonin is also shown to cause effects like hypotension, depression, and decrease the seizure threshold. Since melatonin is over the counter, it isn't regulated to the same degree as prescription medications. When off-the-shelf melatonin was tested, the concentrations can vary widely from the labeled concentration, up to a 10-fold difference. There can also be a large amount of variation in the concentration from one pill to the next. This variability is especially bad with chewable tablets and capsules, while tablets and sublingual tablets were a little bit better, and liquid forms had the most stability between the different types of dosing. Now I'd like to talk a little bit about how I approach melatonin in my practice. I generally try to appreciate the complex and subtle nature of the circadian rhythm cycle. If you just think about how we regulate adenosine, which is by drinking coffee, it becomes clear that more isn't always better. Even though we might be tired one day, we don't go from 1 cup of coffee to 10 cups of coffee because we know that intuitively that's just going to mess us up for the rest of that day and could mess up our natural cycles for a few days down the road. Melatonin should generally sort of be treated the same way. Research is starting to show that we've really been overshooting the mark with melatonin doses and massively overloading our natural circadian systems when we take, for example, 10 milligram doses. For the most part, this isn't too harmful, but it can disrupt our natural melatonin cycle and could be causing subtle imbalances in our hormonal system that might actually perpetuate insomnia. We do know that plasma levels are very sensitive to oral melatonin, so in my practice I try and supplement in a way that I think is relatively close to the physiological range. In general, I favor the cycle shifting approach, and I think it's actually pretty effective for most mild forms of insomnia. While I don't stop people's melatonin routine if they feel like it helps, I generally discourage the use of high doses, regular use of melatonin, and use of melatonin for more than a few weeks. I will make some adjustments if people say that certain sleep issues are persisting even when they're taking melatonin. Melatonin should really only be used for a short-term fix or to get a few nights of good sleep or to adjust to a new routine. If insomnia is an issue for more than a few weeks, patients should really consider behavioral treatments, especially things like CBTI. This can be done with a therapist, through CBTI apps, or through books even. Next, I'd like to give some specific recommendations about brands that I like to use and give the instructions for how I recommend patients take melatonin. Now, keep in mind, there's a lot of variation in how psychiatrists recommend melatonin, as well as variations between what you'll see in research papers and what you'll see on package instructions. So all of this should sort of be taken with a grain of salt, and you should do your own experimenting to see which doses and timings are the best for you and how your body reacts to the melatonin. The one thing that I think is really important to keep in mind is that when you buy a random melatonin product off the shelves, a lot of times the dose that it says on the package might not be consistent with the dose that you're actually getting. It's important to try and find brands that actually have reliable dosing labels. And two brands that I like to recommend is Natrol and Nature's Bounty. When we think about the dosing of melatonin, I'll tell you what most psychiatrists will probably recommend at this point, and that's going to be about 1 to 5 milligrams of melatonin about an hour and a half before bed, give or take a little. In my view, that kind of splits the difference between the cycle shifting model and the hypnotic model. And what I like to do in my practice is first I'll actually try and just target the cycle shifting model, and if that doesn't work, then I'll move on to the more hypnotic model. As far as the cycle shifting model goes, I like to start with Natrol liquid melatonin, and I really like this formulation because it is a liquid, which means that it's very consistent between dosing, and it's a very small dose, or it allows for very small dosing without having to cut a tablet into little tiny pieces. 4 droppers of this is just 1 milligram of melatonin, and I actually really like that because I would recommend even starting with just 1 dropper or 0.25 milligrams of melatonin and see how that works before you go up to higher doses. In general, I'd maybe recommend you take 1 dropper to 4 droppers anywhere between 2 and 4 hours before bed. Again, this will just sort of kickstart the natural melatonin cycle, and then your body will sort of take it from there. It'll start increasing the melatonin levels on its own, and you'll just naturally find that you want to fall asleep a little bit earlier than you normally would. For example, if you wanted to fall asleep at 10 p.m., I would say maybe take 2 droppers of this at around 7 p.m. or 3 hours before and see how that affects you. If it works well, you can maybe even try and use just 1 dropper, and if it's not enough, you could try a little bit more. If that doesn't work, then you might want to move on to the next strategy and try this other product, which is Sleep 3 from Nature's Bounty. Now, this is actually a 10 milligram melatonin tablet, but it's extended release melatonin, so it's sort of released bit by bit throughout the night. I like this a lot better because it doesn't hit your body all at once, and it actually, rather than preserving the natural melatonin cycle within your brain, it actually kind of mimics it in a pretty accurate way, meaning that the melatonin is sort of distributed with the highest peak concentration in the middle of the night. The issue with that is that sometimes you can get a little grogginess the morning after, but then you have to experiment maybe with taking it at an earlier time in the night. I'd recommend you probably take this around 1 hour before bed, give or take a little bit. That could be 2 hours, maybe 30 minutes before bed, anywhere in that kind of range. You'll have to kind of see what works best for you. But this one will give you a solid dose of melatonin that should cause some of that hypnotic effect, meaning that you'll actually get tired after taking this medication and want to go to bed. and hopefully you won't have any of those midnight wakening. You won't wake up in the middle of the night with this medication either. So those are my 2 recommendations. But in general, you can do some experimenting on your own to see which doses are right for you. Try and start low and then build up to higher doses and see how that affects your system. In the comments, I'll list a few other melatonin brands that have been shown to contain a consistent amount of melatonin that's reliably similar to what's advertised on the package. And I'll also give a link to a few different websites that can be used to help in seeing which brands of melatonin can be best trusted. I'll also provide a few links for where you can buy melatonin online as well. But in general, brands like Nature's Bounty and Natrol are have pretty good reputations in the field, and ones that I would consider if you can find them on the shelves. So thank you so much for watching my video on melatonin. I hope that some of these tips were useful for you, and I hope that you can use them to get better sleep. If you're interested in this kind of content or like this kind of material, please like, subscribe, and comment for more videos to come. Good night and take care.